वर्षकु HbA1c परीक्षा केते थर करा जिबा उचित जानतु केउ मधुमेह रोगी को कौन कही स्वास्थ्य विशेषज्ञ। मधुमेह रोगी को सबु समय निजर शर्करा स्तर नियंत्रण करने को पड़ता है। यह जानवा उपवास एवं सकाळ भोजन परे रक्त परीक्षा करा जाय थाए। रोगी माने प्रायतः यह परीक्षा गुड़िक घरे किंवा निकटस्थ लैब को जाई कराई थांती। ए सबु बात शरीर में ग्लूकोज रो मात्रा जानवा को मधुमेह रोगी को HbA1c परीक्षा कराइबा उचित। यह परीक्षा को मधुमेह निरीक्षण करिवार सबुठारु निर्भरयोग्य उपाय बोली विवेचना करा जाय थाए। यह 2 ରୁ 3 मासर हाराहारी रक्त शर्करा स्तर रिपोर्ट प्रदान करिथाए। यह परीक्षा केबे एवं केते थर करा जिबा उचित जानतु कोन कहउछंती मधुमेह रोग विशेषज्ञ। HbA1c परीक्षा जहाको डाक्तरी भाषा रे ग्लाइकेटेड हिमोग्लोबिन परीक्षा कहा जाए केवल गोटे किंबा 2 दिन पाई नुहे बरं मास पाई सुगार स्तर विषय रे सूचना प्रदान करे। यह हाराहारी सुगार स्तर विषय रे मध्य सूचना प्रदान करे जो मधुमेह नियंत्रण स्तर और परिमाण अंतर्भुक्त। गोटे दिन रिपोर्ट अपेक्षा HbA1c परीक्षा को जरूरी बोली विवेचना करिथांती डाक्तर। मधुमेह रोगी माने यह परीक्षा नियमित भाव में करबा उचित।
It is the gold standard for assessing long-term control of diabetes. However, it is not the gold standard for diagnosis of diabetes. That is what is meant. So I'll explain the difference between the two. HbA1c, as you rightly said, is a measure of the long-term glucose control for 2 to 3 months. So it's not 120 days, it's about 60 to 90 days is what it is. It was developed, you're quite right, in the late 1970s to 1980s it was developed, and it still remains as the gold standard for assessing the diabetes control. There is no problem with that, and I'll come back to that later. Now, for years, people said, why not use that as a diagnostic test? In the 1990s, they proposed it, and the American Diabetes Association said, no, the standardization of the test is not good. In 2000, they proposed it, and they said, no, it is still not good. 2010, the American Diabetes Association said, no, now everybody is ready, the test is standardized, and from 2010, the American Diabetes Association said that a HbA1c value of 6.5 is enough for diagnosing diabetes. The moment that was published, I published an original report based on thousands of patients who, not from the clinic, from the epidemiological studies, and this was published in their own journal, in Diabetes Care, criticizing it, and I said glucose still remains as the best test for diagnosis. Either a fasting glucose or an oral glucose tolerance test, 2-hour value, should remain the gold standard. And in that paper, which was published immediately after the Americans Diabetes Association published it, I showed them how if you use the HbA1c for diagnosis, you will miss many cases and you will wrongly diagnose many cases. They were good enough to publish it, and they said, yes, we welcome this counterpoint. However, we will see, the problem is that in US, they don't have the patience to wait for 2 hours after a glucose tolerance test. So because they just want to give a fasting and then go away, they cannot wait for 2 hours. In India, they're prepared to wait. My patients are prepared to wait. So we never had that problem. So because of that, they didn't want the gold standard test, which is the OGTT. I'm still talking about diagnosis of diabetes, not control of diabetes.
विश्व स्वास्थ्य संगठन एवं डायबिटीज फाउंडेशन परीक्षा केते थर करा जिबा उचित से विषय निर्देशावली मध्य जारी करिसंती। यह अनुसार मधुमेह रोगी माने प्रति 3 मासरे थरे HbA1c परीक्षा कराइबा उचित। जो मधुमेह रोगी मानकर सुगार स्तर प्रायतः नियंत्रण बाहर थाए से प्रतिदिन मासरे निश्चित भाव में परीक्षा करबा उचित। जितेबेले कि सुगार स्तर नियंत्रित थिबा रोगी यह प्रति 6 ରୁ 7 मासरे यह करबा आवश्यक। से भली HbA1c रो साधारण स्तर केते रहिबा उचित तथ्य उपर नजर पकांतु। 5.7% रु कम साधारण, 5.7% रु 6.4% प्री डायबिटीज स्तर, 6.5% किंवा अधिक मधुमेह मेलिटस।
Below 5.6% HbA1c is normal. 5.7 to 6.4 they said was pre-diabetes, and 6.5% and above is diabetes. That is what they said. Immediately the World Health Organization, WHO, and the International Diabetes Federation, they did not agree with the ADA. And they said for pre-diabetes it cannot be used at all. Till today, for pre-diabetes, only in the US this value is used, HbA1c between 5.7 and 6.4. Rest of the world did not accept it. We did not accept it in India. In fact, in India, we did not accept HbA1c even for diagnosis of diabetes, because just like in the US, they said in 1990 that the labs were not yet ready. In India, the labs are not ready. If you send your HbA1c to 3 labs, you will get 3 different results. In one you will be normal, in one you will be pre-diabetic, in one you will be diabetic. So with that lack of standardization still being there in India, we and others, the Research Society Study of Diabetes in India, the Endocrine Society, all the societies have said that HbA1c should not be used for diagnosis of diabetes. That is why there's nothing much new in this new article which was published, because that is something which we have been saying. Now, for diagnosis of diabetes, either a fasting glucose above 126 for diabetes and between 110 and 125 for pre-diabetes, or an OGTT, the oral glucose tolerance test at 2-hour value above 200 is diabetes, from 141 to 199 is pre-diabetes. So that remains as a gold standard. HbA1c can be used in addition to these two, but not as a single test. Now, many years ago, we published several studies. Unfortunately, most of them are not, none of them in fact are quoted in this paper, which is in this publication. But we showed through several studies, all India studies, Chennai-based studies, Chennai and Delhi studies, many publications, original publications we had based on population-based data, where we showed that if you use HbA1c, the prevalence of diabetes will double.
आजिर दिन में सारा विश्व में हु हु होई बढ़ी चलुछि मधुमेह रोगी संख्या। भारत हेबाकु जाउछि डायबिटीज कैपिटल। वर्धित रोगी संख्या आगामी दिन में महामारी रूप न नेब कहवा असंभव। ए सबु भितरे खाद्यर जत्न सहित प्रतिदिन शारीरिक कार्यकलाप द्वारा यहाकु नियंत्रण करिहेब। कटकरू कैमरा पर्सन अभय मलिक कालीचरण रंजित का रिपोर्ट, कनेक्ट न्यूज।